medicine specifically, people think if I go see a therapist, they're going to put me on drugs. That's our last resort. And I think that's what people really don't understand about mental health. I want to know how you're doing if you're sleeping, if you're eating. Those habits I'm going to change first. I'm going to change maybe your daily routine and help you with that before I ever put you on medicine. I work with younger kids, right? And so, give you an example. I'll say, go put him in football. He's got anger issues acting out in school before I ever put him on a psychotropic med. Why? He's got coaches. He's got aggression. He can get out in a natural, fun way. Routine, football practice 4 or 5 times a week, right? They're on that field. So we have to get people to understand that mental health treatment is not synonymous with medicine. Mental health treatment is just that. It's treating the mental components, which could be changing anything else from a physiological perspective. I can tell you, go get a dog. Emotional support animals are huge right now. Everybody's getting a pet. Why? Because it changes our system, our nervous system, right? Just by petting your animal. That's what medicine does.
I think that is important. I'm also, what I would describe it as a victim, because I was on Ritalin and everything when I was young. I was actually in Elizabeth General when I was a kid, and I was around kids that were suicidal and a lot of different things. And I definitely feel like a lot of those facilities and different things that I was in, it's illegal now that I look at it as a grown up. I remember like, situations where I was about to fight, and the next thing I know, I'm mad, I'm angry, and then I'm literally hanging up. They had these beds that they pushed up, and you're literally on the wall, and literally like,
you get your PRN.
You just wake up. I used to just wake up. Like,
yeah.
I don't even remember what happened. I'm calm.
Yeah.
They got my donuts and just,
I did residential for 5 years. I worked in a residential facility. I was the crisis support team lead. But one of the things, and the reason I took that position was for that reason. It's kids can be acting out, kirking out, throwing things. That doesn't mean we have to give them a drug. How do we de-escalate? How do we help without giving them medicine, right? And of course, residential treatment has changed probably since you were a kid. Even right now, it's different. Still, medicine has its purpose. And I do tell people, biologically, we know that some of our diagnoses like depression, anxiety, there's biological components to it, right? That's where the medicine helps. But that is still should be our last resort. We should be saying, hey, have we made sure food and diet? You know, when you talk about Ritalin, I always say to folks, people were giving their kids coffee for a really long time to help treat attention and focus issues. But we look at now, we're saying, hey, it's the wheat, it's the dairy, it is the red dye. They just recently did something with red dye, right? And so thinking about diet changes.
She want me to look at her because she always talking about red 40 dyes.
Yeah, listen, they just, but there's truth to that, right? So one of the things, and I look at, for example, when I'm working with families, I'll say, what are the allergies? There is something with food allergies, food sensitivity that dysregulates your system. When we were younger and you go to bed hungry, right? Some of these kids, even the idea of old fashioned, they give you crackers and send you to bed because it helped regulate your system so that you can go to sleep. There's a whole movement, gut health, looking at our gut. How many kids, first thing when they're scared and anxious, their stomach hurts, they have headaches, right? The somatic symptoms that we start to feel. Well, if we can treat those things, then oftentimes behavior starts to change. And so I do say to parents, are we giving them things to eat that are good for them system? Have they had bowel movements? Because even if you go to a psychiatric emergency room in a crisis, they're going to ask you the same thing. Are you sleeping? Are you having bowel movements? Again, looking at how that impacts regulation. Kids with allergies, they can't focus. Guess when do we start school? Right in the middle of allergy season. Right? So now, I always say this, I said the height of allergy season in the US is September, October, right when our kids go back to school, and then all of a sudden they can't focus. For some of our kids' focus issues, it's not about Ritalin, it's are they on allergy medicines? Put them on allergy medicine, now they're able to focus in class.
So let's unpack this and let's take our time, right? So let's go into this conversation. So even with these new phenomena, because not that it's new phenomena, I know for me as a parent, and so many people, social media and these different evolutions and revolutions, right? But when I was young, it was no such thing as red 40 dye. These was now latest. These was Tootsie Rolls.
Uh-huh.
This was Ice Pops. This was just
The
normal
candy
life.
lady,
This
listen.
this was just normal life. And we
Right?
had bags of it. We
Yes.
had bags
Yes.
every day, Jolly Ranchers, Snickers,
Listen.
like Halloween was
Uh-huh.
Thanksgiving. We didn't even
Mhm.
eat, just candy. And it's like now as a grown
Yes.
man and as a father,
Mhm.
thinking of a 7 year, no wonder I was fighting, running, jumping, hopping, kicking,
Yeah.
flipping, tripping. I could go on too.
Mhm.
Punching,
Yeah.
karate, chopping,
Listen.
uh, like whatever, like,
Mhm.
but it was no language.
Right. No
Even as my
education
mother,
around
like
it.
my mother,
Mhm.
uh, transparent.
Mhm.
Cause I literally like go through a process and a render. My mother literally, it, while she transitioned overall, like when you talk about health, but
Mhm.
my mother went with a fight. You ain't moving no juice.
Mhm.
You ain't touching her refrigerator.
Yes.
You're not touching the snappers.
Mhm.
You're not touching the high C. You know, and it's like that tradition. So I unpack all of that
Mhm.
transparently. How do you get through to the parent that don't have the wisdom, the knowledge, the
Mhm.
education? And this is tradition. This is, oh, this
Yeah.
is in our family bloodline that we have diabetes, that we show up this way, that we have weight issues. And no, how can you tell me it's not the medicine? Look how calm he is.
Mhm.
He sits down when I give him the medicine. So what are you talking about? The medicine is not helping, right? So can you communicate for the parent or the person that may say, Mom, look at this. Look at what Dr. Stacy is saying. She is saying that this is affecting this and this. So can you communicate the young lady that showed her mother this video?
Mhm.
Like, even though your son is calm in this moment, what are the effects? What are the after effects of that medicine?
I'm going to unpack your question for a second. The after effects of the Ritalin,
Ritalin,
whatever it is.
yeah.
Okay. So I'm going to answer that in two ways. One of the biggest things we have with psychotropic medicine is we don't believe it works. If you're,
Is that okay to say?
that is okay to say.
As a therapist,
As a therapist.
I know we
Well,
get
listen,
into it.
most, and I'm talking for the layperson individual that's watching this that
Yeah,
has no idea, right, about Ritalin, for
yeah.
example, right? They'll watch a news clip or something where they'll say Ritalin doesn't work.
But they see their children calm and it's
Mm-hmm.
doing what the doctor
And
said it
it's
would
doing.
do. Yeah.
And here's what I always say to parents about medicine. If it is helping your child to do well, that's the only reason why we recommend it. Most people don't walk into a doctor's office, a therapist, a psychiatrist office for medicine when their kid's doing well.
Mm,
It's because your kid's off the hook. I
mm,
mean, really, like
mm,
literally off the chain,
mm,
right? And so I always say to them, again, it's the last resort, it's the last thing we want to try. But even for me, it's the last thing that I will say to a family. We're going to try everything else behavioral first. The American Medical Association says if it's behavioral issues with kicking, spitting, all of those things are age appropriate for a 4 and 5 year old. I'm not putting a 4 and 5 year old on Ritalin if they're being disruptive in class. They're 4 and 5 years old.
mm,
One of the things that we have to get around though is at some point, when do we say yes, it's time to explore medicine? And I say when you've done therapy for at least 2 to 3 years, you've put behavioral strategies in place, you've changed diet and exercise, you've done everything from a natural perspective that you can. You have your kid on a sleep routine, they're doing well with technology, that's a whole nother subject. Because at that point, then as a parent, I can say I've done everything I can to help them to do well.
mm,
They're still not doing well. Let's see if the medicine will help.
mm,
That's where I take families in treatment. I don't rush to put them on medicine. I'm not a prescriber for one, right? So
mhm,
I always tell people you think every therapist is a prescriber. I'm not licensed to prescribe. So you walk in, that's not my prescription is going to be behavioral treatments
mm,
first. My prescription is going to be let's make sure your 7 year old is in bed by 8:30,
mhm,
not 10:30 at night, and
mhm,
you're wondering why they're disruptive, irritable, angry. They're not even getting good sleep hygiene.
mm,
And so things like that, we have to educate families. And we are trying to, it's this idea that we don't have the resources, so we can't do those things.
Mm.
You know, if I only have access to the dollar menu, then that's what my kids are going to eat.
Mm.
And I say, yes, however, we can do things like take away the bread, right? Even on the dollar menu, get chicken nuggets, right? Things that might be a little bit healthier. So there's tweaks that we can make. I'm a big advocate of teaching families where you are, right? Again, not this idea that they're going to organic, diet. Well, if you can't afford organic diets, then that's not what you're going to be able to give your child. But can we make smarter decisions on any menu? Absolutely. And that's where we start. We scare families when you say you have to change everything you're doing. Like, right. And I can relate when you said about your mom. My father passed with lung cancer, and he was on oxygen. And he would say, I will smoke a cigarette right now if I wouldn't blow up, right? Like that's how much he wanted a cigarette, right? But again, we can't say take it all away. With technology, I don't tell parents take it all away. No, you know what? Technology actually can be a reward. I can have kids who, in the morning, even to get them through their morning routine, if their parent says you can have 10 minutes of your technology before you leave, if everything is done, those kids get everything done quick. But that parent's been for 9 months yelling, screaming, fussing in the morning just to get them to do the same routine. That 5 minutes of extra playing time can get them through in the morning. So sometimes it's not telling them take it all away. It's becoming more creative and creating solutions. As a clinician, my mindset is problem solving. My mindset is don't sit there with the same problem. Give you an example. Kids are at the dinner table. They're fighting with each other. True stuff that comes into my office that people come in with, right? And they want me to fix that their kids are fighting at the dinner table. And I'll say to them, well, have you tried moving their seats? Well, no, because I have to sit at the front and wife has to sit here. And I'm like, did you try moving their seats? Something as basic as problem solving, coming up with solutions that work. Why do we keep having the same problems every single day and then yelling and screaming? It doesn't work.
I always say that if today's problem is tomorrow's, if today's problem, I literally forgot the saying. Today's problem is tomorrow's problem if you don't fix it today.
If you don't fix it today and you don't come up with a solution. And it's not compromise. I always tell parents, I'm not a reward behavior chart parent, a therapist. I will never tell anybody to do behavior charts. But what I do tell people, it's interesting. Insurance companies, they used to punish us if you had tickets, right? Now what do? Safe drivers apps, right? They reward you. Why? Because reward works faster with changing behavior than punishment ever did. And they're doing that even at the insurance level for us adults. That's how you change behavior.